Hello out there and welcome to Public Conscience. This is the anti-corruption program produced by the Progressive Impact Organization for Community Development, PRIMOG. PRIMOG is a civil society group with a mandate to promote good governance, participation and accountability in Nigeria. I am Adaobi Obiabomo with Chidozie Ogbonnaya.
Welcome to the program.
On Public Conscience on Radio, we seek to evolve a corruption-free society through the amplification of corruption stories reported by our partner media organizations and drawing citizens and government attention for democratic actions against it. This program is supported by the MacArthur Foundation.
Today we will be looking at yet another topic of great concern to our well-being as a nation. You will hear how the actions of some corrupt officials, health officials, are endangering the lives of thousands of people living in Enugu and Ondo communities in the fight against yellow fever and Lassa fever. This story was first reported by The Cable.
This story is not just about the corruption and extortion in Enugu and Ondo over the management of yellow fever and Lassa fever, but also the occurrence all over Nigeria. So brace up because you are about to hear more. And please be ready to join us through phone and text messages. The WhatsApp line to send your message is 0902-265-6167. That is 0902-265-6167. Remember that this number is for messages only.
Please begin to send your messages as soon as possible to 090-2265-6167. The numbers to call will be given shortly.
As a Nigerian, are you aware that yellow fever vaccine is free? Do you also know that birth registration is free for those under the age of 18? How often do you ensure that you are not shortchanged by corrupt government officials?
An investigation published by The Cable has revealed how extortion by some health officials, lack of personal protective equipment (PPEs), shortage of health personnel, among others, are undermining the fight against Lassa fever and yellow fever.
At Uwani General Hospital, Enugu State, between 300 and 500 naira was extorted from poor Nigerians before yellow fever vaccine doses were administered to patients. While on the vaccine card, vital information such as the name of the vaccinator, phone number of the local government inspection officer were conspicuously missing.
Just like in Enugu, at General Hospital Owo, Ondo State, most of the health workers fighting Lassa fever had no proper PPEs on, thereby exposing themselves to possible infection despite the billions of naira spent by the federal government on PPEs.
Also of concern was the level of uncleanliness at some of the health centers, dilapidated, abandoned structures, and uniform lamentation of lack of medical personnel to attend to the patients in hospitals and health centers The Cable visited.
Unfortunately, in November 2020, about 40 people were killed when yellow fever rocked the Ete and Umopu communities in Enugu State. Another 70 persons also reportedly died days after, as the strange disease, as it was described, stretched to other surrounding local government areas.
And just to refresh your minds, in 2019, PRIMOG, in an undercover investigation, exposed sale of unauthorized yellow cards on the streets of Abuja at the sum of 5,000 naira by touts to travelers without actually immunization. And with the funds going into private pockets, and it happened right here in the nation's capital. A chief matron in the Port Health Department of the Ministry of Health was shown the way out as a result of PRIMOG's investigative report. But the Federal Ministry of Health did not tell the public what happened to the over 500 copies of the stolen yellow cards worth millions of naira. PRIMOG bought one of these yellow cards on the streets in Abuja.
But for better understanding of this report, we have in the studio investigative journalist with The Cable, Chinedu Asadu. Welcome to the program.
Thank you so much for having me.
And we will be speaking to the reporter, James Ojo, via the phone, all the way from Lagos.
Hello, James.
Hello, good morning.
Thank you for joining us. And how is Lagos today?
Lagos is fine.
Okay, let's quickly get down to your reports. What were your findings in Enugu and Ondo State, and how serious is the problem? But let's first begin with Enugu State.
Yeah, like we all know already, the Lassa fever outbreak was a very serious issue in Enugu State, and even within some of the communities I visited, I was even made to understand that a lot of people even died more than the ones that were reported. So it was quite a very serious issue there. And what some of the things I've discovered during the course of my investigation, I discovered, there was a kind of distrust in the system. Like, people don't really even trust the government if the figures they are giving out, as regards the outbreak was real. I spoke with Amara Ura, for instance, and one of the is a resident in Enugu Metropolis, and he believed, that some of these figures might actually be inflated, just maybe for the government to get more allocation out of that. So I discovered a kind of distrust in the system. That's one of my findings, and I also discovered a kind of extortion or corruption in the system too. Because when I visited Enugu, the original aim was to ascertain how the response rate in terms of facilities, in terms of manpower. But when I got to Enugu Metropolis, and in the course of my conversation with Ura, which is a tricycle rider in Enugu, he told me that many of these government hospitals that they actually extort citizens, before they administer the vaccine to them, and but this is actually supposed to be free based on the government proclamation. So I decided to visit some of these hospitals, and when I got to one general hospital in Enugu Metropolis, I actually found out that it's true. When I got there, and I was told that I have to pay 300 naira before I get the vaccine, and I was kind of arguing with them like this is free, and but they were not just ready to listen to me. So to find out if to find out the roads and everything in the system, I have to pay the money, and I was actually given the vaccine after paying the money, and then after paying the money, a card was given to me.
Were you given a receipt for the money you gave them?
No receipt was given to me.
So the 300 or 500, how much exactly did you pay?
I paid 300 naira.
So
yes, I gave them 500. I was made to collect 200 naira. So they told me there was no change, and so they were even splitting me that I should leave the money.
So you paid 500 naira.
Yes, so it's a very funny scenario there.
And the money went into private pockets.
Yes, no receipt whatsoever was given for that. So, and I was given a card to satisfy that I'm satisfied. I was on the card, there are a lot of details that meant to be there, the vaccinator, the local inspector, all of that. The details are meant to be there, but on that card, not everything there to show. That's actually maybe they're kind of afraid. The officers are afraid that they could trace them. So some of those details were missing on the card. So that's another, and I discovered that the implication of that is that so many people refuse to get vaccinated. Like when I spoke to Ura, he told me that he went for vaccination. But when he was told that he has to pay, he decided not to get the vaccine again. And until when I interviewed him, and he told me I has not been vaccinated. So this shows that this shows how the rot in the system is actually affecting the response rates to Lassa fever, because when people are shying away from getting vaccinated because of the feeling that they have to pay for what is free, then it means it's actually sabotaging the effort, because it really means a lot of people will be out there with the disease, which could actually be treated with a vaccine, but because of paying out of that. they have to stay put, and some have to die in the process.
James, let's have the Ondo, a little bit from Ondo.
Okay, yeah, from Ondo too, I discovered this kind of extortion in the system, but not quite pronounced like that of Enugu. When I go to Ondo, some of the hospitals, like General Hospital in Itori, for instance, I feel symptoms of Lassa fever, because Ondo is the worst state in Nigeria when it comes to Lassa fever. So when I get to the General Hospital, I face symptoms of Lassa fever that I wanted to. I have some symptoms and I would like to see the doctor. And to my surprise, they were forced people to pay some deals. Like you have to pay for pay for glove. We have to pay 300 compulsory. For the glove that somebody that
the surgical glove.
Yes, you are forced to pay for the glove like that the health official attending to you will use.
How much did you pay?
That was 300 naira. So it was quite funny because in the course of going to the investigation too, I discovered there are some people that were actually arguing with the officials, but they were told that if you don't pay, then that means nobody's going to attend to you. So it shows the helplessness of these officials. It shows the lack of adequate facilities on ground, to address the situation. And some of the other hospitals I visited, like there's which is one of the worst states here in the government. There are some hospitals I visited that they took my samples, the blood samples, without anything on, no glove, no nothing, no
PPEs,
personal protective equipment. And so the health workers are really endangering themselves, their lives, and fighting this.
James, in all these things, did you get in touch with the relevant authorities at the health centers and hospitals, and even the health ministry in the state you visited?
Yes, like in Enugu State, I contacted the Commissioner for Health, that's Emmanuel Obi. On several times, I confronted him with the findings of the investigation, but till today he has not responded, because initially he was telling me, when I told him I discovered some irregularity in the system, he was asking me to provide what did I find and all of that. So when I told him these are the findings, these are the outcome of the investigation, he said he'll get back to me, and today I've been...
He's yet to get back to you.
Yes, the state epidemiologist too, that's Chinyere Ezeotu. I tried reaching her because she claimed that these things are free, all of that. But I tried reaching her several times. She said she'll call me back, and the situation was the same too. In the Ondo, I also reached out to the state epidemiologist, and he actually admitted that they are helpless. He admitted they are helpless, that they cannot really manufacture markings. That's what he told me. That they are helpless.
Take that again. That they are helpless and what?
He told me they are helpless, that they cannot manufacture markings. When I told him about the dearth of personnel and some other facilities in some of these the hospitals, he told me they are helpless because of COVID-19. They have to grapple with COVID-19, Lassa fever, and other stuff at the same time. They told me they are helpless, and that they can't manufacture markings, so they have to do the best they could to address the situation.
Okay. Aside from the 300 you paid for gloves in Owo, did you also pay for to get vaccinated for yellow fever?
No. Though I didn't pay for vaccination. It was free. And in fact, I went for Lassa fever in Ondo. So the Lassa fever in Ondo, the process. When I went to FMC, that's Federal Medical Center. That's the major place where the Lassa fever cases are being handled in Ondo State. So when I got there, I was not allowed into the center where they are treating Lassa fever majorly. So I have to go through the normal process of self-reporting. Like I went to see a doctor and I was tested. Like I would just ask random questions and as far as some checks, I was told that no, that I have Lassa fever that day. So that experience.
Let me take you back to Enugu.
Okay.
You talked about mistrust in the system or distrust. Could you throw more light on that?
Yes, what I mean by distrust is that I spoke with some of the residents in Enugu, and they were actually doubting the credibility of the figures that have been churned out. I mean, the credibility of figures that have been churned out as people that have this yellow fever, because in Enugu we have yellow fever there. So some residents are doubting the credibility of the reports, the figures that are being churned out by the government. So that's what I mean by distrust, because people don't really trust the government if these figures that are churning out is true or not, because they believe
the figures are inflated.
Yes, they believe it's inflated, so they could get more allocation from the government, and so they were actually talking about. So that's what the view some of these residents hold, and some of them are speaking also as regards the rotten system, because like what I told you about, his anger was because he was asked to pay for the vaccine, and so he was looking at generally kind of rot in the Nigerian system where you don't believe the government, where you don't trust anybody. When the government will say this and they're actually doing for their interest. So that distrust, people don't really believe, even when they know that this thing exists. And when I go to Nsukka too, I also spoke with some residents. Some of them are telling me that yes, we have yellow fever, but is it that rampant? Is it that rampant the way we make it?
We must commend you for the undercover report and the risk you took. But before we let you go, could you tell us more about the challenges you faced in the course of this investigation? Maybe one or two challenges.
Okay. The first challenge, like I must have mentioned now, is access to information. I mean, in fact, from the part of the residents, people are not willing to talk for fear of being maybe harassed, for fear of being maybe somebody attacking them. And I think it's a slap on our so-called democracy, because when we have a system where citizens cannot freely express themselves or express their opinions on the ease perceived in the system, I don't think they can call that a democracy. When I went to Enugu, most of the residents I was trying to speak to, they were actually scared. And they would want to say anything, that maybe tomorrow somebody will come and attack them. And aside that, some of them are even expecting me to also give them money. Maybe, you understand?
Okay, the second challenge.
Yeah, so another challenge was the challenge was actually, getting some of these officials to talk. Like, apart from the residents, the officials talking is another challenge. And then sometimes when I visit some of these hospitals too, assessing some of the places where suspected cases or people that have this disease have been treated was a challenge. Because when I went to in Enugu, the community where they had most of the diseases, I wanted to assess the room where some of these people that had yellow fever were kept, but I was not allowed.
Could you just quickly tell us the state of the facilities you found on ground?
Yeah, the state of facilities was really poor, very, very poor. I mean, if you really go to those communities in a day, that's the local government in Enugu State, it's really undescribable, because you wonder if this is a state that is badly at outbreak, such as yellow fever, which when you look at the death rate, the fertility rate is even higher compared to COVID-19 in some cases. So that we have we don't have enough hands in that a community where it was only one person, just a nurse, attending to over 40, 30 people that I met on ground, and it was jumping from one person to another, trying to admit vaccine at the same time, treat people that had headache, all of that. And when you look at the situation, there's no light, the toilet, the so-called labor room, these things they're in poor conditions. And though the situation was the same in some of these facilities too, they don't have the required facilities like the gloves, but manpower too.
Okay, thank you so much, James Ojo. Thank you so much for speaking with us today.
Yeah.
Thank you for the work you do for Nigeria. Thank you so much. We appreciate you.
It's a pleasure being here. Thank you.
We must commend James, but we still have Chinedu Asadu with us. Chinedu, welcome once again.
And for those listening to the program, you're still on to Public Conscience, a production by Primark, the Progressive Impact Organization for Community Development. Chinedu, thank you so much again for joining us.
My pleasure.
Chinedu, from your report, the officials extorting Nigerians, from the report we just heard, extorting Nigerians who want to get the yellow fever vaccines don't seem to be afraid of their actions. What is responsible for this show of boldness in committing fraud in our government institutions?
Thank you for the question. First of all, I would like to commend my colleague once again, James Ojo, for that very wonderful report saying, an expose that reviewed the three states of, the infrastructural decay and the corruption that's in the system, the health sector. So I think most of the officials that were indicted were bold to perpetrate those acts because they know that the government overlooked some of these things. So it's not the first time that we're seeing this kind of sabotage in the system, but in most cases, the government wouldn't act decisively on them. So because they know that they're probably going to get away with it, almost like...
You're saying it's the backlog of inaction by government.
Exactly. So it's almost like a norm, knowing that even if they get reported, that there is the likelihood that the government isn't going to punish them for that, for the crimes that they are perpetrating in the system. So it emboldens them. It also encourages others to even overlook it. So when citizens know that this is wrong, you don't have any choice than to just adapt to the system and play along.
For how long shall we continue to adapt to the system and play along while the decay, the rot in the system continues, and it affects everybody? Everybody. And remember that this program is interactive. The WhatsApp phone to send your message is 0902 265 6167. That is 0902 265 6167. We'll encourage you to send your messages immediately, and would also want those who want to call in to react to these questions. How would you react to what you have heard? Are you aware that yellow fever vaccine is free? You pay 2,500 if you need yellow card for travel purposes. Otherwise, a green card to indicate that you have taken the vaccine is enough. Do you also know that birth registration is free for those under the age of 18? Would like you to share your experience. Have you encountered any form of extortion in the course of registering your child's birth or getting vaccinated for yellow fever? You only pay 2,500 if you need yellow card for travel purposes. Otherwise, a green card to indicate that you have taken the vaccine is enough. Do you also know that birth registration for your child that is under the age of 18 is free? Let me quickly highlight some of the things James said. In Enugu State, he found out that there's distrust. The citizens probably do not trust the government enough because they feel that there's an inflation of the figures, and also extortion. But in Ondo State, he was made to pay for gloves. Ordinarily, citizens shouldn't pay for gloves when they get to the hospital. These are things that should be provided for by the government. Citizens should not be made to pay for gloves, especially now that we have COVID-19. These PPEs should be readily be available. And he also highlighted the decay in facilities. If you go through their reports, you find out, you see the pictures, you would wonder if these facilities are actually where citizens, patients go to. You go into such facility, you have malaria, leaving the hospital, only God knows what other ailments you might contract before you leave there. But let's come back to Chinedu. Are citizens aware that they are being extorted and that the vaccine is free, or are they helpless?
I think they are very much aware. Like James pointed out, a number of them are helpless, knowing that if you don't, comply, you're not going to get the service you are requesting. So if you don't pay for that money, nobody's going to attend to you, and you can't do anything about it. Unfortunately, it's very shameful where you see corruption institutionalized, like what is happening in Enugu and Ondo states. So it's not a case of ignorance. They know that they are not supposed to be paying for some of those services to get gloves and to get their vaccines for the disease. But because of how rotten the system is, you can't do anything, even if you report them. And I don't believe that the officials at those facilities are not aware that the health workers indicted and are doing those things. I believe they must have been reported, about those acts, but they are probably failing to act. So the citizens are just left with the option of either playing along or going back to your house without getting the service you require.
Do you think that this extortion we are talking about and corruption is widespread all over Nigeria?
So far from what we've been seeing, I think it is, but not to a very large extent, because I believe there are still some persons doing the right thing. There are still a lot of health facilities that are, doing things as they are supposed to. So if it's happening in Enugu and on the states, it's not the likelihood that it's happening in every other state.
You will not be surprised to see it in any other state.
Of course, and from what we've been seeing, it's happening in every other state, but not very much widespread at the community level. At the level of the primary health care centers, some of them are still playing by the rules. Some of them are still doing things according to the due process, but it's widespread in terms of how coordinated the act is, because a number of them also know that in these places this is also how it's been done. So that also emboldens them, knowing that you can't be left out. If your colleagues are collecting money, extorting people to get vaccines and to get gloves, then why can't you also join the bad gang?
So you're saying there's this collaboration?
Yes, you've seen that in more cases. Yes.
Adobe, can we say that because these monies people are being extorted are not so big, is making people look away, just turn their eyes off it, say, okay, 200, what is 300, what is 500, but it's crime.
Josie, 300 naira, 500. You think it's small because you are in Abuja. For those, I don't know if you've been to one in Enugu State, it's like our normal village. Okay, we all come from a particular village, Abia State, whichever state you're from. Do you know how much they labor to plant cassava? How long it takes for them to harvest? And the processes. Then you want to ask, how much do they sell this cassava or gari for those that produce gari out of it? Then you know the stress, the labor they go through to get 500 naira.
So
and for
at
them
that
to
level
part
is big.
with 300 is a huge sum. To some people, for those of you in Abuja, those of us in Abuja, 300 is still big. 300 can ferry you from city center to Karo. 300 can buy you a plate of rice.
Sure, but
so it's not
I'm
too
just
big.
saying that maybe because the
not
money
too
is
small.
not too big, is making citizens not to really, hammer on it. We see it every day. We pass by. You say just give them and have your way and go your way and get
But
your
we shouldn't
vaccination.
allow
But
it
it's not
continue.
good. It's not good.
James mentioned that one of the challenges he faced was access to information with respect to the citizen now, not the government.
Yeah.
That some citizens are not willing to provide the necessary information needed. What do you think would be responsible for that?
I think most times people are just not comfortable with
I
being
have
in
to
the
cut
limelight.
you short. Sorry,
Okay,
please, you
fine.
still respond to it. Hello. Your name and where you're calling from?
My name is Goodness, calling from Abuja.
I didn't get your name.
My name is Goodness, calling from Abuja.
Okay, goodness, let's hear you.
Okay, now this extortion you're talking about, it's everywhere in the system. You understand? Now, I know of someone, he had an accident. He was rushed to the hospital in Kuji during the heat of COVID-19. Can you hear me?
Go
Loud
ahead.
and clear, go ahead.
Now, he had an accident. Instead of him treated, they asked the person that brought him to go buy hand cream. Common hand cream. Now, I don't think that, so attending the name as an emergency case. They don't on the floor. Before the person could get the hand from the man and died.
Wow.
So that's the kind of system I just love me. So it's a very serious situation.
Okay, thank you. So,
Secondly,
we can hear you, goodness.
so I'm calling to report this because now it has taken someone's life. It is as small as 300 naira globe. But someone died in the process.
That's unfortunate.
Okay, that's quite unfortunate.
It's not in all those states or any of the states. This will happen during the peak of COVID-19. Last year.
Okay, thank you so much for alerting us. I mean, from what goodness just said, it's so pathetic.
It's touching.
Gloves, right in Abuja. So this is not about the
But
rural
if you-
areas now. In the FCT, someone dies because of gloves.
As little as that.
Hello.
Hello, good morning.
Good morning. Your name and where you're calling from?
My name is Mary. I'm calling from MCT.
Let's hear you, Mariam.
Alright, please, I'm calling in respect to the birth registration that you did mention that it's meant to be free for children under the age of 18.
Yes, it is free.
Like maybe somebody, a daughter, she's under 10, and then my son is 10 years of age. Then I have to go to Guaranta Hospital to get the birth registration for the 2 of them because the one we had got me in the process of relocating to his new apartment. And then I was asked to pay, I think, 5,000 naira for the 2 of them. You know, after much deliberation, I think we ended up on a 3K. See, tomorrow, I've not been able to get one for them. You know, because and then I was asked to provide the photocopy of the house that they had, which I've been able to. I think what I'm going to pay right now is right in my car. But I'm like, why would I go and pay money when they keep saying that, okay, this thing is meant to be free? And then I'm thinking that it's one thing for government to declare those things free. It's another thing for the government to set a body that will regulate as in the ensure compliance that these things are actually they're doing. These things are still going on. Till tomorrow, people are spending money to get vaccinated. I have to pay for my kids too, you know, for the vaccine. Because just like somebody did mention, and just let me just pay so that I don't, you know, I don't waste my time or keep going to the hospital every day. And trust me, if you don't pay, you spend the rest of your life going to the hospital to get that particular service, and you still will not get. You don't blame people. They want to follow the bandwagon. Let me just do it for things to go. You know, because if you don't do it, you'll be stagnant. You'll just be there. Okay, now tomorrow now, I'm still trying to go to Guaranta Hospital. And trust me, if I go there, they'll still tell me to pay money. So there should be bodies, they should be able to ensure compliance. So all this, not just saying it's free. What are they doing to ensure that it's actually free? And then what is the penalty for people that are going to deport? There should be a regulatory body. I mean, there should just be, as in, they should just take it seriously, not just take it on, it's free. What are they doing on their own part to ensure that this is actually free?
Thank you so much. We understand your plight. We've had the FCT Director of National Population Commission come on this program to authoritatively say that birth registration and the accompanying document, birth certificate, is free. Primorg has also engaged severally on sensitization. We've had series of meetings with the birth registrars to ensure that they do not charge or extort citizens while going or coming to register their birth. Birth registration and the documents, birth certificate, is free. So they encourage you. It's challenging, yes, when you get to them and you tell them, oh, it's free, I shouldn't pay. They might want to frustrate you. They might want to keep you there, delay you. But again, it is free. You must insist and get the document for free. Thank you. You were saying something before the calls came in.
Yeah, thank you. So I was responding to your question on why most times people
citizens
don't
don't avail the
yeah.
reporters'
and
information.
I think it's because we have, in most cases, people are usually not comfortable with being in the limelight, and that's because we're in a system where even though there is freedom of expression, your freedom after expressing yourself isn't guaranteed. So you've seen in many cases where some people get traced out by the governments because they admitted some faults in the system. They raised an alarm on what is happening. So people don't want any problem. So they are comfortable with living with the challenge as it is. They are comfortable with paying those bribes rather than coming out to raise the alarm, and maybe tomorrow they hear that the police is inviting them. and maybe charge them for terrorism or some funny, charges. So it's
a citizen who provided information willingly to stop the corruption in the process.
I mean, you've seen a number of cases where people, get invited by the authorities, by the police for saying some things, even though there is evidence, and that's because the system is just okay with some of these acts. So the police they are not interested in investigating the issue being raised. They are more comfortable with ensuring that person is dealt with, and that's usually in the command of some persons. It could be the people involved, it could be the government, depending on the level this is happening. It could even be local government chairman threatening somebody with police just because they raise an alarm on what is happening. So most times people just want to stay away from that trouble and live with this.
The last caller, Mariam, raised a valid point, talking about regulators or monitors to ensure that this extortion stops. Do you toe the same line with her?
I totally agree with Mariam, but I think what's happening is most times the regulators are overwhelmed, because of the widespread practice of what maybe the bet restriction you're talking about now. You might be surprised to see. I'm happy you say Primark has done a lot of work on that, and I believe you already saw how widespread it is. A number of health facilities that are charging people. So how are these regulators going to ensure compliance in all these facilities? So there should be a sustainable framework to ensure that even when they are not there, people get to understand that this is free. So it's not just a regulator visiting a particular health center to ensure compliance. What if they are not there? How are the managers of that health facility ensuring that people are not extorted? So it also has to do with citizens taking action themselves. So if you see that this is being done in a particular hospital, people are being charged to register their children, you should also raise the alarm, alert the authorities, alert the regulators. They are not everywhere, so if you don't tell them, they're probably not going to know that these people are still extorting people. So even if you're doing enlightenment and all of that, it's still important to keep them updated on what is happening. So if you find out that this is still happening, I've seen a number of cases where some authorities act decisively on issues raised. So sometimes they ignore, but a number of them as well act. So if people are alerting them on these things, so they can't be everywhere, but people have to take action themselves, alert them what is happening, and I think it's going to help in the long run, because we're talking about sustainability. So when they are not visiting these facilities, what is happening behind their back?
Talking about alerting the authorities and then the monitors, we amplified a report done by the ICIR, as International Center for Investigative Reporting, on some particular product, honey this time around, that has NAFDAC registration number, but the product was not really certified by NAFDAC. Apparently there's somebody in the system who goes behind to collect monies from citizens, those wanting to register their products, and then issue those numbers to them. We amplified the report. We got NAFDAC involved, and I must say that the particular person was suspended. So talking about getting the authorities involved, it works. Though there might be a delay of some sort in the system, but it definitely works, because they might not be in the field. They might not know what is obtainable there. I'm not trying to make excuse for them. They should know what is happening there, but there are cases where they don't know what is happening in the field. It is the responsibility of the citizens to alert these authorities, like government officials, to say XYZ is happening, there's some sort of extortion, there's some sort of corruption, for them to take action.
Must they be prompted always before they act? Because
that's why I said I'm not making an excuse.
No, yes, you're on the right track here. But what I'm saying is this is happening everywhere. From what people are saying, we want to hear that one person was suspended, just like the NAFDAC. When we have people serving punishment for their sin, for their deeds, that will discourage people from going into those acts. I don't know what you think about that.
I totally agree with you. When people see that they can't get away with a crime, they are called to order, everybody falls in line. But when it's a normal practice for the authorities to ignore these things, they will tell you what's the worst that could happen. You raise the alarm, but I'm still here. So yeah, when people are punished, it goes a long way to address these issues.
Because I'm going to give one example. When my wife gave birth, I didn't know because I left for work. Before I came back, they said they paid 200 naira for child for the birth certificate. So, and I was so pained. I went back there. I wanted to chase everybody out of the office. They were now calm down. So I pointed it out to the woman that
please hope
this
you retrieve your money.
Definitely not, because I was threatening fire and brimstone that day. And so the thing is this: the regulators, do they go around from time to time? Because if they go around, they will get a culprit. And
just to also let us know that it's not official. The last caller did mention that the initial price she was told to pay for birth certificate was 5,000, and she started negotiating back and forth. Finally, she was made to pay 3,000. If it is official, there's no way it will come down. The price will come down. No matter how much you plead, you will still pay the official price. But these things are not official. Also, we should also try to look at the MDAs for these birth registrars. These registrars, are they taken care of? Do they provide the necessary documents needed for them to get to the field? Because we also found out that one of the centers we visited, one of the registrars said, see, I'm out here, but these documents, no pen. NPC did not provide pen for me. Citizens should not be made to pay for the lapses in those organizations. Ordinarily, it should be the responsibility of NPC to provide these things for the registrar. But a situation where you do not provide the needed documents for them to go out and register citizens, they would extort. But citizens should not be made to pay. And as a citizen, which is why we have said this over and over again on this program, that birth certificate is free. You should not be made to pay for the lapses in their own organization, in their own ministry, in their department. Then for the hospitals where they are asked to pay for vaccine, yellow fever vaccine, I mean, it's free, it's everywhere. The official amount is 2,500. That is if you need the yellow card for those who are traveling outside Nigeria. But if you don't need the yellow card, I mean, all you need to do is just to get the vaccine. Then the state of the hospital, I don't know what the Ministry of Health is doing. Because from the reports, you find out that, okay, from what James said, one nurse attending to over 30 patients. How is that possible? How efficient will that nurse be?
Yes.
Will she at some point not make mistake? Oh, I'm supposed to give X this injection. Because she's confused, she's overwhelmed, she takes the injection for patient A and administers it to patient D. So what happens?
That's disastrous. That's disastrous.
Okay, and for those who have been made to pay for this document, to pay for birth certificate or for yellow card, we would want to ask, would you insist that you're giving a receipt? But we know how some of these people operate. They can go get a receipt somewhere, and which is not official, okay? But again, it is not enough for you to ask for receipts. Yes, you should ask for receipts, but just know that birth certificate is free, yellow fever vaccine is free. Don't be part of the corruption in the process, the extortion. These documents have been provided for citizens by the government. And like we always say on this program, we encourage you to go and register your birth because it enables government to plan. We've complained severally that we don't have data. How then do we get the data if you don't register your birth? Let's take this call. Hello.
Hello, good morning.
Good morning, sir. Could you turn down the volume of your radio set?
Alright.
Okay, your name and where you're calling from?
My name is Adi.
I'm calling from
Akoko.
Let's hear you.
Thank you for this program.
God help you. What is happening in Nigeria hospitals these days is that majority who are working in medical line now, starting from the gate man working in the hospital, down to the medical doctor, nurses, pharmacists, laboratory technicians, the majority of them are not of God. They are going there because of money. They are going there because of what the evil they want to practice, not because they want to help human beings. When we were working, when I was there now, before I retired, we work not because of anything, not because of the patient. We want the patient to come back tomorrow and say thank you, or see us by the roadside and say we want to, he or she want to pay for our transportation. No, I'm not till now over 60 years. For now, I did not go work in a miraculous manner. But the expecting God's miracle in our lives. See, what is happening in medical life is only God that can come in. Those people who want to go and read medicine and surgery, nursing, and other medical whatever, they don't allow them to go in and do it. You have to know somebody and to know somebody before you can get to that school. And the people that know somebody are the one there. Could you believe that medical line now, either government or private, they are now working with evil, working with Satan. There must be a particular number of people that will die in a month in each department.
Is that information verifiable?
Well, I'm only telling you the truth. I'm not saying you should take it.
Okay.
So what is going on now? Evil people are now majority of
Thank you so much. Our time, we are pressed for time. Thank you so much. Thank you. We appreciate your contribution to the conversation. How do you verify such information? Okay.
It's a personal opinion.
Yeah,
there.
but when he talked about the passion, you can easily relate to that.
Yes.
Are they passionate about the job? He also talked about corruption in terms of getting admission into medical school and all of that. But when you begin to deviate and say Satan and all that, then you're going spiritual.
It's personal.
And it's not based on facts. You can't verify. Okay, thank you so much for your contribution. Chinedu, the last take from you.
Before I want to ask him this so that he wrap up with it. Chinedu, how can we reduce corruption and other challenges bedeviling the health sector, and what would be your advice to the government?
Thank you for that question. I think, like Ada pointed out earlier, we have to ensure that the authorities that are there to ensure, to implement these laws, to implement the policies in place, they are up to, to the task. So where a case like this in Enugu and Ondo is happening and it's almost replicated in other states, it's very important to see that the relevant state ministries and other institutions that should ensure compliance and clean up the system, they are up to their responsibilities. A number of them are those, a number of them are just there for the sake of being there. At the state level, at the local government level, a number of the health authorities there, at the primary health care centers, they are just there just for the sake of it. So what happens when the citizens raise the alarm at that level, even if before it gets to the level of maybe the Federal Ministry of Health now, we can't even do anything because this is happening at the state level. So what happens when they raise the alarm at that, at that level? Yeah, it's very important to ensure compliance. And then we should also try not to condone corruption in the system. So how fast does the government act to punish those that are indicted? This is for how many weeks now the cable published this report. I've not heard about anybody suspended from their duty posts or prosecuted for these crimes. So it's almost as if they are going to condone it. How long will you continue to see such in the system? So if the government is fast to act on issues like this, people are going to know, okay, yes, we still believe in this government. They are still capable of, calling people to order. And then their colleagues are also going to fall in line, knowing that if you commit a crime like this, there is a very high probability that government is going to find you and they're going to prosecute you and maybe sack you. So it's important to act very fast when issues like this are reported.
Okay, thank you so much. Yes, we have a message from Sam Ekpese from Airport Road at Abuja, and he says, health workers are not different from the other government workers, but for the ethics of their profession, The corruption in the system in Nigeria cuts across all sectors, including our health sector. I believe no amount of remuneration and incentives will stop the greed of health workers except the system in which they work is overhauled. Thank you so much for your contribution, and I want to appreciate those who have reached out to Primorg to stop corruption in the system. We also want to encourage you to also reach out to Primorg and report any attempt to extort money from you. Our phone number is 0902-265-6167. You could send us a message or an email to info@primorg.org. Insist on your right. I will say that again. Insist on your right. It's not easy, it's not convenient for you, but we must insist. Dozie, we must go.
Alright, that is how we are wrapping up today, but please visit the news page of our website, news.primorg.org. That is news.primorg.org. For all the details of our reports and interviews, visit our website, primorg.org, to get all the information about Primorg.
And you can watch our videos on Primorg TV, our YouTube channel. We encourage you to subscribe to get reminders when we have a new post. We sincerely appreciate our guest, Chinedu Asadu. Thank you so much for being here.
My pleasure.
And James Ojo, the investigative journalist from The Cable, who joined us via phone from Lagos. We sincerely appreciate you. Public Conscience is supported by the John T. and Catherine V. MacArthur Foundation, committed to building a more just, verdant, and peaceful world. Get more information about the foundation on its website, macfound.org.
Do well to join us here next week for another interesting episode of Public Conscience. And remember to follow us on our Twitter, Facebook, and Instagram @Official Primorg. I am Chidozie Ogbonnaya.
Remember that you can give us information on or hint about corrupt acts through our phone 0902-265-6167 or info@primorg.org, and I want to assure you that Primorg will follow up with whatever information you provide us with. I am Adaobi Obiabumo. Stay safe.